Hi guys, good morning. This is Dr. Behnam. Welcome to another AMA session with Dr. Behnam. I'm the co-founder of Happy Ed as well as the Chief Medical Officer. So thank you so much for joining us on another Tuesday morning. So today, the topic of the day is how is Happy Ed different from other companies and our competitors. So I'm just going to share my screen with you guys. Here we go. So Happy Head basically was founded by me. I'm a board certified dermatologist, and basically the way we're different from other people, other companies, is that first of all we're hair specialists. So when you send a consultation in, you're literally having a board certified dermatologist basically examine your scalp, examine your past medical history. Now this is different from other people where they just have a nurse or a PA looking at you who don't really have basically any specialty or any background in hair. Number two, we have a customized formula, and that's what really sets us. It really keeps us differentiated from other companies like Hims, Keeps, Roman, Rory, and basically what it is a customized formula. If there's a formula that basically that doesn't work for you, we'll go back and change the ingredients and send you another one so that you get basically the right product that you need. Our product includes basically a couple different things in it: topical finasteride, you could have topical dutasteride, minoxidil, retinoic acid. So the multiple ingredients basically all in one. In contrast to taking just like an oral propecia, we're basically just one product. Also, one of the most important thing is that majority of all the other companies, from Keeps, Hams, Nutrafol, Vegamore, Pros, basically what it is that it's all mass produced. So they're producing these products 10,000 at a time. It's sitting on a shelf and basically being shipped out when you order it. With Happy It is different. The product is literally produced when you order that product. The reason because it's a customized product, so it's made just for you. We don't know what you're gonna order. So when the order comes in, basically we're gonna order that product for you. We're gonna make it custom, made custom fresh just for you, and it's then shipped out basically to you. From our manufacturer. So it's made when you order it. We're also going to have shampoos and conditioners and amazing supplements that we're going to come out soon. So that is coming out soon. So we're gonna wait a couple more weeks for that. So thank you so much. And now I'm going to exit that. Here we go. Okay, now to all the questions. By the way, I really enjoy all these questions on Tuesday mornings. Thank you so much, basically, for joining us. So any suggestions to help minimize sexual side effects from finasteride? Well, the entire point of Happy Aid was that we made a topical finasteride because based on clinical studies, the studies show that the topical has lower risk of sexual side effects compared to the oral. So that's the whole point of Happy Aid, to reduce the sexual side effects of topical finasteride. Also, if you're very worried about the sexual side effects, even on the topical, which could still happen, I highly recommend that you do not use the product aggressively right away. So instead of using the products like twice a day every day, I would probably recommend using it once a day for the first 1 to 2 weeks to let your body adjust and acclimate to it. Usually we recommend 2 pumps twice a day, but you could do 2 pumps once a day, or you could do 2 pumps every other day, or even 1 pump every day to start out with. Remember, it's not a race. You want to start as slow as possible, basically to achieve your best results. Thank you so much for that question. And one of our patients asked from Instagram, is this available in Europe? Unfortunately, no, it is not available in Europe. We're mainly in the US at the moment. Do you think finasteride is more prone to regrow hair or maintain what you have? So really, it's really 50-50. You're not going to know until you try the product. In my personal clinic, I've seen patients take finasteride, and it has caused amazing amount of hair growth. And I've also seen patients use finasteride and just it maintains the hair growth. It really depends on the person. It depends on where you are on that hair journey. Look, if you have a lot of hair, and you're not losing much, so it's just going to maintain you. If you have a lot of miniaturized hair and you're thinning, then it could actually help grow out that hair. Thank you so much for that question. Can happy head thicken thinning areas? Yes, I mean it could. See, when you have miniaturized hairs, what happy head does is that the finasteride in it is a DHT blocker, so it prevents the scalp. It prevents the formation of scalp DHT. As a result, it prevents and reverses that miniaturization. We also have minoxidil, which is a vasodilator, which by increasing the blood flow to the scalp, it actually causes more hair growth and also reduces, it just washes away the DHT in the scalp. So the combination of those two active ingredients basically could help thicken the hair. Again, realize that results varies, so you're not going to know until you try it for about 4 to 6 months. I've had some FUT procedures, but it's been about 20 years. I had a good head of hair, but I was thinking about having another FUT procedure, just to thicken up my hair since I'm now getting older. Do you think I should try Happy Head first and see what results I get, ideally to avoid another procedure? Absolutely. We have a lot of patients that come into our practice in Los Angeles that are thinning quite a bit and they want to get hair transplant or they want to do PRP. And we always say, look, before you spend thousands of dollars on another PRP procedure or stem cell or transplant, why don't you try Happy Head for a few months? And look, it doesn't always work, but believe it or not, there are some patients that they come back and they have so much thickened hair that they're not even candidate for transplant anymore. So I always say try it first, see how you do. It's a much, much cheaper and honestly easier option than having transplant done. Do you think dermal rolling microneedling to a scalp could help happy head with absorption? Absolutely, yes. We typically recommend the dermal roller 0.25 millimeter depth. You could buy that. You could just buy that online, and we typically recommend applying the happy head product first, and then you're going to gently dermal roll on top of it. Remember, the key is being gentle, basically not being too aggressive, and definitely that will help with the absorption and basically get better results. I'll always put Rogaine in a small spray bottle as opposed to a dropper or foam when I apply it. Can I use Happy Head the same way? Absolutely, yeah, there's no problem. You can put in a spray bottle and spray it. The only problem is, when we initially started Happy It out about 2 years ago, they were all spray bottles. The problem is that the minoxidil could block up the spray, so you might have to change the head of the spray once in a while. Also, you really don't know how much you're actually spraying out when you use the spray bottle. So that's the only thing. But you could definitely try it. Basically, maybe do 10 sprays, and that might be equivalent to about like 1 ml. But thank you so much for that question. So I think the Happy product is very, very effective. Well, thank you so much. We really appreciate it. More information on the impacts to DHT levels, which is very similar to 1 milligram oral finasteride at 1 ml of Happy to apply. There is real systemic impacts with DHT. So yes. So let me explain this. So there are a lot of there are two pharmacokinetic studies done on topical finasteride compared to oral finasteride, and the studies do show, and they're all listed on our website, that the 1 ml of Happy applied twice a day gives you very similar pharmacokinetic changes to scalp and CMDHD compared to oral finasteride, which means that the oral and topical is affecting you basically the same way. Now, the question is, why is it that a lot of people don't necessarily have the same side effects on topical as they do with the oral? It's just because probably the oral is affecting some other stuff that topical is not. Um, Also, our patient here asked, someone happy must determine the impacts on PSA levels it meant. So there's really no clinical studies done on topical finasteride as well as PSA level. In the past several years, a lot of, the recommendation right now is that there's no mandatory PSA testing on patient, even on oral finasteride. But we do recommend that, if you're in your 40s or 50s, that if you do see your doctors for PSA testing, you should tell them that you are on finasteride. Um, but we're always trying to do studies on it. So thank you for that recommendation. I do once a day and it works well. But thank you so much. Look, it is true that some patients do use it once a day and it could still work. But again, remember, everyone's different. Some people need a twice a day application and some people need a once a day application. When will the Happy shampoo and dermal roller be available on the market? I'm gonna look at my VP of operations over there, Eric. I think our um by June. It's going to be available by June. Eric is working on this day in and day out. He gets up early in the morning. We check in with our manufacturers. The key is quality control. We just don't want to come up with any random product. We're really working very hard to make the best shampoo, best conditioner, and honestly, one of the best multivitamins, hair vitamins out there. We're making it. I know a lot of our patients are our competitors, which is fine, but we're making a product better than our competition.
Derma roll is ready, so we'll include it in a few of these people orders.
Yeah, the derma roller is already ready. So if you order it, basically the derma roller is already being shipped out with some of the new product with the new orders.
Yeah, and we'll include it for the folks attending this.
Yeah, and actually, it will also include a derma roller for any of our patients attending today. If you don't mind, just send us an email. Say hi. Can I have a derma roller? And we will send a free derma roller with your next order. So just give us an email. And we're gonna put and our email is already up there. help@happyhead.com. Thank you so much, Eric. If you can't apply Happy Head day and night because of your work schedule, what is the recommended time in between each application? Honestly, there's really no set time. Look, you just don't want to be putting the product on like every hour. Then you're just gonna get too much irritation. So you want to give it like about 8 to 9 hour basically time difference between the two. So thank you so much for that question. I was on a call with a patient this morning, and they were asking, how they could, they were asking that they were using minoxidil in the past, and it was very irritating, and they were concerned about the minoxidil in our formula. And I assured him that, look, if you start using our product and you're getting some irritation, which sometimes could happen because we have a higher dose of minoxidil, one thing you could do, first of all, you could just wash it out after 1 hour and you're going to be fine. It's still going to work. Number two, you know, send us an email back and we'll be more than happy to either reduce the minoxidil concentration in your product and also take away the retinoic acid, which could be sometimes irritating. Again, if too much irritation happens, the steps that we do basically to avoid the irritation is as follows. Number one, instead of doing it twice a day, you could do it once a day. Uh, you could also do it twice a day every other day. Number two, you could wash it out of your scalp. Number three, you could use a leave-in conditioner, not a leave-in shampoo. A leave-in shampoo is going to dry you out more. A leave-in conditioner. Also, if those methods don't work, send us an email. We'll reduce the minoxidil concentration and take out the retinoic acid. Also, there are some serums out there that we could send you the link. That basically is a hair serum that you could apply on your scalp, and what it does basically it just reduces the irritation. Again, we are here to help you guys out. This is a prescription formula that is customizable just for you. So if you're having any issues with it, please let us know and we'll help you out any way we can. I know last week some patients asked about the aloe free formula. We are still currently working on it. So we're gonna let you guys give you guys an update on the next week AMA. One of our patients from Instagram asked, "Are you guys going to come up with a topical test ride?" We actually do have topical dutasteride available already. It is currently on our website. If you don't see it, basically the way you do it, you order the same way and you just say, "Look, I just want topical dutasteride." So it's the same ordering method. I know it says finasteride under ordering customizable, but just say I want dutasteride and we'll switch it out for you. Can you talk about the kitchen sink formula? That's a very good question. So the reason why the kitchen sink was developed was because there were a couple of reasons. First of all, we wanted to put all the products all in one because there's actually an Australian study that did that. Number one. Number two, there are some patients that actually do topical finasteride every day and they take an oral finasteride like or dutasteride a couple times a week, and patients tell us that it works better. So although the dutasterides hits both enzymes, but for some reason when patients combine it together, they tell us they see better results. And also, we have seen this in clinical practice that when patients are on the finasteride for a long period of time, or sometimes even for a short period of time, basically it just stops working. And that's true with the oral and topical. So by adding two in one, the dutasteride and finasteride, we are hoping that you just get a much more robust hair growth. Thanks so much for that question. Okay, so I'm also going to go back to some of the topics that we talked about last week. So first of all, one of the questions that people ask that can I order multiple bottles at a time? Yes, you could order like 3 bottles at a time. We could basically post a link for you guys as well. So that's a very commonly asked question. Number two, people always ask about happy at pregnancy. We always say if your wife is pregnant or planning to get pregnant, but basically if you guys are actively trying, just do not use the topical happy head. You could use an oral alternative as well, and happy head does carry the oral finasteride as well. Number three, patient always asks again about customization. They want to customize the formula, take one thing out. It's very easy. Feel free to send us an email, and we'll be more than happy to customize that product for you. Number four, if you have any side effect issues, send us an email. Help a happy head. One of our doctors will definitely basically get back to you right away. Also, the role of derma rolling. Derma rolling increases the efficacy due to the fact that it just creates a lot of tiny hold into your scalp. As a result, your penetration is more. So the derma roller that we typically recommend is a 0.25% derma roller. It's 0.25 millimeter derma roller, and we do have that available. And if you don't have one, please let us know, and we'll ship you out one for free. Um, other topics, we also talked about the difference between finasteride and dutasteride. So the difference is that finasteride basically hits one enzyme, whereas dutasteride hits two enzymes. So dutasteride technically could be a better product, but we always still recommend, since finasteride has always been the gold standard in the industry, that you start with the finasteride first and see how you do. So we have a patient from Instagram that says, "Will your product work for women who have hormonal imbalance?" Well, if you have hormonal imbalance, you should probably see your doctor in person and try to figure out that hormonal imbalance. But that being said, yes, the product works for male and females. And we do have both male and female formulas. With respect to finasteride, we do not give finasteride to females below age 50, but we do have the spironolactone formula. Spironolactone was traditionally an oral medication, but now we do have topical spironolactone. One of the questions that sometimes comes up is that spironolactone does have a smell to it. So we do add some peppermint basically to kind of mask that smell. But if you think your bottle has like an odor to it, let us know and we could probably make it again for you. Thank you so much for that question from Instagram. Uh, so, so let's talk about some of the other topics that we've talked about in the past. Again, how do you do the customization on your initial consultation? Is very easy. As you're doing the online order, basically there's an area that says talk about your history. You could just say, look, I just don't want any minoxidil in my product, or I want to reduce the concentration of minoxidil or the concentration of finasteride. Is really whatever you wish. We will try to customize that product for you. How does spironolactone work differently from finasteride? So let's talk about spironolactone for a second. Oral spironolactone is a blood pressure medication that has been around for many, many, many years in the U.S. market. Oral spironolactone is typically used for adult hormonal acne, but is also the number one medication for female hair loss. In the US, we do not use it for males, but it's only used for female hair loss. The way it works is that it blocks the testosterone from binding to the testosterone receptor. So compared to finasteride, where it's a DHT blocker, which means it prevents testosterone from being converted to DHT in the scalp, spironolactone is just blocking the effect of your regular testosterone binding. So we were one of the very first companies to actually start manufacturing topical spironolactone. And look, new things are always a challenge. And the biggest problem we had with topical spironolactone was that it had a small odor to it, and it has an odor to it. So what we did, we added basically other like fragrance in it to basically to mask that. But we still have a lot of females using it. Females do like it. So if you're female below age 50, you could order the spironolactone, or you could just order the minoxidil 6% without the spironolactone. If you're female above age 50, you don't have to order the spironolactone. You could just order a regular formula, the finasteride with minoxidil. Okay. Um, So, I'm just going to talk about a little more about the ordering process. So when you go online and basically place an order online, we do ask you for just your past medical history, allergies, medications, because a dermatologist has to review your order. And then after that, we do ask you basically to upload your photos, because technically this is like a medical office, so we have to review your photo to see if you're a candidate for Happy It or not. And we do have to verify you legally, so we do ask for your driver license as well. Those are just medical legal requirements that we have to do. Also, let's talk about our shampoos for a second. Do you mind giving me a bottle of our shampoos and a conditioner so we could talk about it a little bit more? So, guys, so we designed basically our shampoo. That's not the shampoo bottle. Okay. So we designed. Sorry, we don't have a bottle here. So we designed. It's okay. So here, actually, I'm going to show you one of our labels so we could tell you. So this is one of our labels based on a shampoo. So one of the most important thing about our shampoo bottle is that this is a biotin collagen shampoo. So and this is what we love about it, because what we did was that we went through the clinical literature, when basically we scanned through all the products out there in the market, and we saw basically what is working the best for majority of patients, and we tried to combine all those ingredients basically into our product. So basically it is developed by us, again, dermatologist, and so ours has argan oil, biotin, collagen, keratin, and saw palmetto, basically DHT blocking ingredients that's really going to help basically, just help in conjunction with that happy product to stimulate more hair growth. Also, we are introducing a prescription grade shampoo on our website, the ketoconazole shampoo, and that should be available shortly. It is a prescription product. In clinical studies, it's been shown to increase and thicken the caliber of your hair follicles. And also, we are going to come out with our multivitamins. So let's talk about the vitamins for a few minutes. So there are a couple essential, basically like vitamins that you really need for hair growth. One of the most important ones is basically vitamin D. Our recommendation typically is 2,000 IUs of vitamin D on a daily basis. We also like biotin as well, and also for females, we highly recommend adding iron to your diet as well. So our new vitamin basically has a really good amount of collagen in it, biotin in it, which again, so it's a very similar to our shampoo. Our shampoo is also a biotin collagen shampoo, and it is also in our vitamins. We're adding a lot of biotin and collagen to it, in addition to iron, vitamin B6, B12, and also we're adding 2,000 IUs of vitamin D. So you don't have to take basically separate vitamins to really achieve what you need. It's just one multivitamin basically that has everything in it. And that should be released in June, and we were super excited about it. And with respect to the multivitamin, we've realized that to really be effective, you do have to take multiple capsules a day. So ours is 4 capsules, but they are small capsules. So basically, just take 2 in the morning and 2 at night. And the most important thing about it is to be consistent. So the more consistent you are about taking your multivitamin, doing the shampoo and the Happy product, the better results you're going to get. And more importantly, actually about the Happy, the more consistent you apply it twice a day every day, the better results you're going to get. Again, I'm going to review some of the questions that somebody asked today. Can I use the product once a day? Look, some patients do use the product once a day and it still does well. Again, initially, you do not want to start being very aggressive with the product. So that means don't start basically using it twice a day every day, just because of the fact that sometimes going to be cause some irritation. So I highly recommend 2 pumps once a day for about a week or two, and then you're going to do twice a day. Also, derma roller is going to increase the efficacy of the product. So what we say basically, apply the product first and gently derma roll. I know on the internet everybody talks about using the 1.5 millimeter derma roller. That honestly is too deep and that is going to cause more pain. So my recommendation is get the 0.25 mm derma roller and basically gently basically derma roll. And again, we do have derma rollers and we'll be more than happy. We just got them, so we are sending it out to our patients as well. Um, the other basic questions that come up very routinely is that, well, how long do I have to use this product? Well, just like everything else, every other hair product, I mean, once you start, you pretty much have to use it forever. Now, when you combine it with other things, like for example, multivitamin and hair thickening shampoos, basically the Happy product does tend to work better, just like everything else. Another question people always ask is, if I'm already on Happy Head, can I add oral finasteride to the regimen and see if I get better results? Yes, you can. Now, we do not recommend starting oral and topical simultaneously. So we usually say do the topical first, let your body get used to the topical finasteride, and then you could add oral finasteride to the regimen. Um, Now, if you have already been using the topical finasteride, and sometimes patients say the efficacy starts to wane, look, we could always switch you over to topical dutasteride. That is not a problem. Remember, we are here to help you out. This is a prescription grade product, and this is a customizable product. The product is made fresh for you on every month, basically before it is shipped out, and it's not sitting basically on a shelf somewhere. So if you feel the product is not working out for you and you're having any problems with it, reach out to support, which is Help a Happy Head, and we'll be more than happy to customize the product for you and change some things and ship you out another one, because we want you to ultimately be happy. If you're happy using the product, you're going to be using it for a long period of time and you're going to see better results. Ultimately, it's all about the results. Well, guys, I think that's it for today. Thank you so much for joining us on another AMA with Dr. Benham. We really appreciate it. If there's any questions, please feel free to email us. Our email is help@happy.com. And we have an 844 number and like a 800 number as well, which is 844-962-4247. And you can also text us at our 213 number, which is also listed here as well. Again, any questions, let us know. Oh, hold on one second. Oh, sorry, there was one more question. I didn't see it. If it's used once a day, when do you expect to see initial results? Will it still be 3 months? No, it is not 3 months. It's probably going to take a little bit longer, basically, for you to see the results. More like about, again, 4 to 6 months. And that's why we usually recommend the first 1 week, use it basically once a day, or the first 1 to 2 weeks, and then you're gonna go up to twice a day. And by using it twice a day for the first 4 or 5 months, that's when you're gonna start to see the really good results. And then after that, sometimes when patients do see the really good results, then they taper it down to once a day and basically do as a maintenance dose. Thank you so much for that question. All right, guys. Well, again, thank you so much for joining us. I want to thank you, Eric, our VP of our operations, and Evelyn, who basically assists us every week, managing everyone's questions. Again, if there's any questions, feel free to give us a call. I also want to give a huge shout out to the rest of the customer service here at Happy Ed, who have been working very hard and tirelessly every day, answering questions and making sure that all the orders basically go through to our dermatologist and our manufacturer every day. Thank you so much, everyone, and we'll see you guys next week. Have a beautiful day.